Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're diving into a condition that affects nearly 1 in 4 adults around the world, and many don't even know they have it. Yes, we're talking about fatty liver disease. It's silent, it's sneaky, and if left unchecked, it could lead to serious liver problems. But the good news, it is reversible. So join me today as I welcome someone I deeply admire in the field of integrative and regenerative medicine, Dr. Bryn Henderson. He's not only a physician, but a pioneer, someone who believes in treating the whole person, not just symptoms. Please welcome Dr. Bryn Henderson, an advocate for next generation healing therapies, to this portion of Doctor. Well, let's start at the very beginning. A very good way to start. What is fatty liver disease?
Great question. Fatty liver disease are where there's fat deposits in the liver cells. So fatty liver happens when there's too much fat stored in the liver. Now, a little fat is probably normal, but when it builds up too much, it can start to cause problems. And those problems are inflammation and even liver damage over time. If not addressed early, they progress from fatty livers to fibrosis or even cirrhosis.
Okay, whoa, stop. Let's explain what fibrosis of the liver is. That first step of going from fatty liver, mild, to fibrosis.
Fibrosis begins with inflammatory conditions and then moves towards cirrhosis, which is the scarring. And those are not reversible. That's a problem.
So, what do you see with fibrosis?
Mostly it's an enlargement of the liver from the inflammation.
Oh, okay.
And then the scarring tissue begins as it attempts to repair. Remember, the liver is one of the few organs that regenerate. So it can repair and replace the damaged cell. But you get too many of them and they overwhelm, causing the scarring, which is moving from fibrosis to the result of a long time, and that's cirrhosis, which can not only cause symptoms, but if it's too late, it is a silent killer.
All right, so everybody's heard the word cirrhosis attached to people who are alcoholics. So, well, wait a minute now. What if someone doesn't drink alcohol at all and their doctor says, you have fatty liver?
Yes, that absolutely happens, and it happens every day. People who abstain from alcohol, but they have too many fatty cells from their diet in their liver, which moves from the inflammation and the scarring and actually into irreversible changes in function. So there's metabolic dysfunction associated with steatotic liver disease, a large mouthful that means that the liver has become too clogged with too much fat, and it's usually associated with obesity, diabetes, and cholesterol that's high.
Okay, so guess what? I had a 16-year-old boy with fatty liver.
Oh,
Yeah.
16-year-old must have been overweight with
Yeah,
diabetes. Did he have diabetes?
300 pounds, no diabetes yet. He'll have it tomorrow, but not today.
And his blood pressure?
Blood pressure was good.
Wow.
Just said liver enzymes were high. Cholesterol, of course, was high.
And how about genetics? Did it play a part? What's the status of his family history?
Yeah, I didn't get into that. The mother was in the room, of course, almost hysterical when I had to send him for an ultrasound of the liver and it came back fatty liver. I had to send him to a nutritionist because obviously he was eating junk food, but is it just fat foods? Is it just oils and fats? Are we talking fried foods? What are we talking about bad food?
Well, and when it begins, it can even begin in pregnancy. So how old was the patient?
16.
16. So it could have happened while his mother was carrying him if her diet was a disaster. But surprisingly, they can look healthy for years and still have this cooking in that liver.
So in my practice, I do a lot of blood work. And so I'll just do a routine. They come in for an annual physical exam, and I tell them I'm going to do the whole enchilada. I'm going to test every part of every organ in your body. And we're just going to see what's going on. And lo and behold, the liver enzymes are elevated.
That's an excellent way to begin. We have the blessing of having ultrasounds in our office. And so that is a little more accurate than just the blood test because you can see the capsule and you can see the size and all kinds of things. And usually in somebody that young, they don't have too much impact if we catch it and their result is such that they understand they have to watch their diet and get in a healthy lifestyle, lose some weight, get active, mostly exercise. In other words, minimize their risk factors.
All right, so let's go back to the alcoholic. So you have a 45-year-old alcoholic who's been drinking for 25 years, and they come in and we say, okay, you've got alcoholic fatty liver. What are we going to say? What are we going to do?
The prognosis is much worse. And of course, now we're dealing with an adult. And although the liver does regenerate, that's going to require some pretty strict lifestyle changes. And it's going to take some medications right away to help heal that liver.
Okay, what are the medications you would use when
Well, you probably want to start with weight loss. And so the loss of the weight as well as healing the liver would probably start with a GLP.
Okay, so in case anybody doesn't know the word GLP, you better learn it because it's going to be a common word in the American language. So we're talking about the weight loss shots, and especially Ozempic, Wegovy, Mounjaro. Now they're calling it tirzepatide. This is a generic and all these things. So you would immediately get them on that?
Absolutely. And I think what you're going to find is as you take this to the next step or two is that you're going to have ability to lose weight dramatically, and that will reduce the fat in the liver. The good news is it can go away. If we catch it early and make some changes, the liver will heal itself. Losing even 5 to 10% of body weight can dramatically reduce the fat in the liver. Add in the healthy living, exercise, and sometimes medications, or better, the intravenous therapies, you can reverse the disease. If it's left untreated or goes too long, then you're going to have permanent damage.
All right, so in your office in Orange, California, you do have IVs that flush out the liver, right?
Absolutely. And the standard is that we start with 8, repeat the ultrasound, see if there's an improvement, and usually there is. And the initial improvement is usually in about 30%. And then we just finalize it with the next 4 or 6 weeks of liver flushes.
And then if they're started on the GLP-1, that does reduce the weight. The other good news is it also helps alcoholics stop drinking.
For sure. There's no question. It helps the whole family, really.
Yeah.
It changes the dynamic because now everyone's eating better because mom's cooking different. You're not having booze at every meal. In fact, the matter is, usually they quit buying it.
All right, well, let's have an example of somebody that's come into your office that you can remember and tell us to give us an example.
This guy had a stage 2 liver, but it could be much worse. His cholesterol was elevated, blood pressure, and blood sugar, that he had some knee pain and osteoarthritis. We started him on a liver flush like I talked about, and we added to that an immune support, and he had to get on an exercise program through the therapist. It was over 2 months until his liver size shrunk to normal levels, but you don't stop there. You have to continue it and maintain it for about a year so it doesn't creep back up where it was.
You know, the one thing that I would like to say is that, first of all, I'm very happy that you have the treatments that you have in your office, because I will tell you, in my practice, which I'm a traveling doctor, so I go from county to county in California and treat people and see people. And one of the things that I find is that the patient is complaining that the doctor isn't doing anything. They're diagnosing, they're saying, oh, lose weight. Oh, here, get on this cholesterol lowering medicine. Oh, okay, goodbye. But they're not doing advanced cutting edge therapy. So if someone who's listening and you live in California and you are fed up with your doctor because they're doing medicine that they were trained in 25 years ago, and you would like to have some advanced new treatment, I highly recommend that you call Dr. Henderson's office and that get an appointment with him. Get in. If you have fatty liver, you do not want to end up with cirrhosis. I mean, you absolutely don't.
Yeah, we focus on the three major goals. We want to detox that liver, reduce the inflammation and boost metabolism, and also support the use of peptides, BPC 157, GLP-1. That supports healing and metabolism. Everything's individualized, tailored to that patient's needs. Sometimes we can add acupuncture or liver-focused meridian therapy, especially for people who respond well to traditional approaches.
Acupuncture for liver health? Really?
Yeah. Well, it's fascinating, but the traditional Chinese medicine's been around about a few thousand years.
5.
Yeah. And so the liver is part of a major energy pathway, and it's called the liver meridian, and we can stimulate that. Like the points code LR3, and on the foot it's ST36 on the leg. So you can help liver function, and it improves significantly with some of the traditional Chinese medicine. And that helps lower the liver enzymes, improves insulin sensitivity, and it's a great complement to medical treatments.
You know, I just love the way you keep track of your patient's progress and you have a plan for them, you give them the plan. What is the percentage of people that stick with the plan? How is it an 80-20 thing where 80% of your patients will stick with it and 20 fall out?
Well, I think that's probably true, but boy, there's a lot of work going into making sure they stick with the plan. We call them. And so after their initial visits, until they become a regular patient, we'll call them once a week and say, are you being a good boy? Are you being a good girl? Yeah.
So there's a lot of attention done to them. All right. So now, how often do you go back? You mentioned you have an ultrasound right in your office, so the patient doesn't have to get an appointment at a radiology center and wait a month. So how often do you follow up with ultrasounds to watch the shrinking of the liver and the healing of the liver?
Good question. And it's done at least every 2 to 3 months. And you monitor so you see not only the liver shrinking, but so is the body weight. If someone has more advanced disease, you might have to have the fibrotic scan. We have that in our ultrasound, and you can measure the amount of fibrosis that's already occurred. And that would increase the amount of intravenous therapy that we'd have to give, but it's absolutely reversible.
Okay, so I would like to say to those listening, do not be afraid of fatty liver. Don't be afraid of it. I know when I've said to people, oh, I look at the result from the radiologist, I go, oh, you have fatty liver. They blanch white and almost fall out of their chair like, are you telling me I'm going to be dead in 24 hours? No, you're not going to be dead in 24 hours, but you have to be proactive and you have to not be afraid of the diagnosis. You've heard Dr. Henderson. He has a plan for his patient. He has a protocol for his patient. He watches you. He can watch your liver shrink back to its normal size and you can see it. He'll let you see it, right? You've got it on a television screen.
Absolutely. The key is to act early. Fatty liver is common. It's reversible. I encourage everyone, remember that liver care in a plan or protocol, exactly like Helen said, is something we can get ahead of.
All right, let's do our mnemonic.
Okay.
Liver care. L stands for?
Lose weight.
I.
Include healthy foods. V is for visiting your doctor regularly.
E
is exercise, often
R.
is reduce sugars and carbs.
And you know what that means, folks? No sodas, no sweets, no white bread, and sorry, no rice. C.
And that's control the cholesterol.
A.
Avoid alcohol completely.
R.
Reverse your insulin resistance, keeping your blood sugar in check.
E.
Is educate. Educate yourself and your family and empower yourself to change.
Well, I've enjoyed myself today. I hope everybody else has too. I thank you, Dr. Henderson, for your wisdom and your empathy and care for all of your patients, no matter what pathology they have. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.